The winter of 2027 arrived like a whisper. It was soft, cold, and strangely uneasy at first. People just brushed off the rising coughs and fevers, calling it just another bad flu season. Pharmacies ran out of cold meds, but honestly, no one panicked, not yet. But in the emergency rooms, the nurses noticed something different. Patients weren't bouncing back. They came in with shortness of breath and then left in wheelchairs, tethered to portable oxygen tanks. What was truly alarming was that some of these people were young, healthy, and athletic, the kind of people who never imagined struggling to climb a single flight of stairs. Doctors whispered about scarring in the lungs that looked eerily familiar, like shadows from the very early days of COVID-19. Still, the official message from the government was simple and reassuring: everything is under control. Behind closed doors, though, scientists were raising serious alarms. A cluster of unusual respiratory infections had appeared in 3 states at once. The pathogen looked like influenza, but it behaved like something else entirely, something faster, something stickier, and something that didn't care about seasons or borders. Dr. Lena Morales, a dedicated virologist at the National Respiratory Institute, stared intensely at the data on her screen. Transmission curves were bending upward in a way she hadn't seen since 2020. She sent report after report to federal health officials, urging them to issue immediate warnings, to prepare the hospitals, and to alert the public before it was too late. But the responses were always identical. They said, "We don't want to cause unnecessary panic." They insisted, "Let's wait for more data," and they concluded, "This isn't the time for public statements." Weeks passed in that terrifying limbo. The numbers doubled, then they doubled again. In the small town of Brookside, ambulances became a constant, mournful sound, their sirens slicing through the quiet night. Families watched loved ones disappear behind hospital doors, only for them to return home changed forever. Some needed walkers, some needed wheelchairs, tragically. Some never came home at all. Rumors started spreading faster than the illness itself. People whispered that the government knew more than it was letting on, that officials were actively downplaying the crisis just to avoid political fallout, that the exact same painful mistakes from the first COVID pandemic were happening all over again. The silence, the denial, the delay. At a community meeting, an elderly man stood up, his voice trembling not just with age, but with raw anger. "Last time they told us everything was fine," he cried out, "and look what happened. We lost neighbors, we lost family, we lost years of our lives. Are we really going to let them keep us in the dark again?" The room fell deadly silent because, deep down, every single person felt that familiar, tightening squeeze in the chest, not from illness, but from fear. It was the fear of déjà vu, the crushing fear of history repeating itself. Dr. Morales finally decided she couldn't wait another moment. She gathered her core team, compiled all the data they had, and released an independent public briefing. It exploded across social media within just a few hours. The headline was stark: "New respiratory virus shows pandemic potential, public should prepare." The government immediately dismissed it as speculative, but the people listened intently. Masks reappeared on faces, schools reluctantly shifted to hybrid schedules, churches cautiously set up outdoor services, communities quickly organized supply drives for hospitals that were already overwhelmed with patients suffering long-term respiratory damage, and slowly, painstakingly, the truth began to surface. Internal memos leaked out. Scientists started testifying anonymously. Journalists uncovered early warnings that had been deliberately ignored. The public realized that the silence wasn't accidental, it was strategic. Not everyone agreed on who exactly was responsible. Not everyone agreed on why it had happened. But one central thing became painfully clear: silence can be as dangerous, or even more dangerous, than any virus in the end. This outbreak didn't escalate into another full COVID-level catastrophe, but it came close enough. It was close enough to remind the world of a painful, essential lesson: when leaders hesitate, people suffer. When critical information is hidden, fear grows uncontrollably. And when a society forgets the past, it risks repeating it with devastating consequences. As spring finally approached, the infection curve began to slowly flatten. Hospitals gradually emptied out. Life started to creep back toward normal. But no one forgot that terrifying winter, when the world held its collective breath again, and no one forgot the lingering, haunting question that echoed in every household: if it happens again, will they tell us the truth this time? Let us know what you think about this hypothetical scenario in the comments below. And don't forget to subscribe for more deep dives into history and potential futures. Thanks for watching.